For those of you who don't know me, I'm Eric Olson. I'm Senior Vice President at BSR, and I just want to take a really quick personal moment and add thanks. We're going to have a thank you fest, guys. I know it's probably getting boring to these guys, but talk about pay it forward and how organizations keep going. It was now just about 13 years ago, and I was not exactly in the wilderness, but I was a recovering management consultant, and this organization appeared on my radar, which had been doing great work and was ready at a point in its evolution to build a global consulting or advisory services practice on top of a group that was already doing great work in training, conferences, education, and you know, very similar, some straightforward, some not so straightforward tactics involving Mats Lederhausen and other people. I ended up getting an offer I couldn't refuse, and I couldn't be happier. So thanks to you guys for letting me do it. Thank you for that. So we're going to turn our eyes back outwards. You've heard a lot about BSR. One of the exciting things that I've gotten to do since I've been here for the last couple days is meet some of the new emerging leaders who are playing roles, taking the work that all of us have been doing and are promising to be taking it, I think, well beyond the next 25 years. I'm going to be in conversation with Dakota Gruener. Dakota is the executive director of an organization called ID2020. You're going to learn what that means and why it's so exciting in just a minute. But she came through an experience which we're also going to talk about with Gavi, the Vaccine Alliance, which I think is familiar to at least some of us in the room as one of the more successful public-private partnerships that from very small beginnings has gone on to have massive impact. So Dakota was Berkeley born and raised. I don't know what it is about Berkeley, but it's 2/3 of our day today. The ultimate liberal arts generalist background, human biology and political science at Brown, and then more or less went straight into the work that we all do, a brief stint in consulting, and then the experience at Gavi, and now directing this very big, ambitious effort. ID2020 is a public-private partnership dedicated to solving the challenges of identity for the more than 1 billion people who currently lack officially recognized identity. Why that matters, we're going to find out, and what it's going to take to get there, we'll find out. Dakota, come on up, please. And we're going to start with a conversation. If you've got questions brewing, I am going to save 5 minutes at the end to take them from the floor. So the first thing I'm going to ask you to do, as I promised, is get you to tell us a little bit more about that story that I outlined. It's just not completely intuitive to me how Berkeley to Brown ends up working on global identity for 1 billion people.
Sure. Well, first, thank you guys so much. It definitely wasn't planned that way. And like you, a recovering management consultant, so I've spent time in that space. I went to Brown intent on working in global health policy. It had struck me that that was the area where one could have outsized impact using tools and technologies that we'd already developed. So it wasn't about curing cancer, it wasn't something wildly unknown, but it was about taking to scale approaches that had long been proven, vaccines, malarial bed nets, et cetera. And that was really the sort of impetus, was huge outcomes using things that we knew how to move forward. I graduated, I went to work for Oliver Wyman, got incredibly lucky in that I ended up working almost exclusively for the Gates Foundation while I was there. So working on precisely what I'd set out to do. And a lot of that was working on vaccination policy and on the market dynamics necessary to bring those vaccines to market in product profiles that were appropriate for use in the developing world and at costs that the markets could bear. A lot of that work focused, a lot of that work focused on how we would provide to Gavi, which is a global public-private partnership that acts as a central coordinating body for childhood vaccines in the developing world. And we were focused on 60% of the world's children, for which the difference between a 19-cent vaccine and a 20-cent vaccine actually made a demonstrable difference. And I was lucky enough at some point to get scooped up by Gavi to go work for them. worked for Gavi's CEO. And my second week on the job, flew to Cameroon for the launch of the rotavirus vaccination program in the country. So this is a pretty big deal, right? The country is committed to protecting infants against the #1 cause of infant diarrhea. And we were out in the field at the sort of ceremonial launch of one of these vaccines. And the regional program manager was sort of standing quietly in the back. And while everyone else was doing the ceremonial injection of the first baby, I went to go ask her how the program was going. And she, much to my surprise, because I'd been told that this region was wildly underperforming, told me that they were doing really, really well, and said, I really want to show you our coverage rates. So this is the number of children that they've immunized over the number of children they should have immunized. And they were reporting 140%. That's not possible, right? they're immunizing more children than exist. And I sort of stopped and scratched my head and tried to understand what was going on, and she, in not these terms, but very quickly said, we've been meticulous in accounting for the number of vaccines we've delivered. The Millennium Development Goals have sort of encouraged us to do so, but we have no idea how many children we're trying to reach. Cameroon's last census was in the 1980s, and they don't routinely register children at birth, and so the denominator of that equation was simply unknown. And that was a huge light bulb moment for me. Particularly coming out of consulting, you think things add up to 100%. And I started pulling on that thread, and you pull and you pull and you pull, and suddenly I end up here.
So that's fantastic. So say a little bit more now. Tell us the ID2020 story. What is 2020? Why
Sure.
2020? Does that mean we get it all done by 2020?
Yeah.
And what does it look like?
So we're probably not going to get it all done by 2020, although I'd like to believe we could. Sorry, the slides may be jumping around a little bit. So there are 1.1 billion people globally with no form of identification. So they've had no birth certificate, they have no passport, no driver's license. And as you can imagine, that profoundly limits their ability to engage in the modern economy. You can't open a bank account, you can't vote, you can't do any of the sort of things that you and I take for granted, even enroll your child in primary school, get access to basic education. And I think for a long time, the challenge to scaling up identity was that we were trying to deliver a paper-based service, and we were trying to do so in countries and in systems that were already stressed to the greatest extent possible. And what we see is that paper-based solutions aren't the answer anymore. A lot of these individuals are living their lives online, and that's true even in markets that are developing economies. And so what we really are thinking about is digital identity. How do we provide somebody with a digital means to prove who they are that is persistent, that's portable? That's a new concept. While you and I have had usernames and passwords and use that to kind of navigate the world, digital identity is sort of as a broader concept is really only emerging now. And so what we've set for 2020 is proof of concept at scale, sort of with significant partners, such that we're in a place to scale that up by 2030 to reach the SDG 16.9, which is legal identity for all by 2030.
Okay, so it rolls up to that SDG. That makes sense. So what a persistent digital identity, a lot to unpack there. Before we go there, though, talk a little bit about why is this hard? So what are the challenges to scaling something like this? These are really big numbers. Obviously, it's not an easy thing to do, or a lot of governments or others would have figured out how to do more of it. What do you need to achieve, and what are the plans for hitting the biggest barriers?
Sure. So I'm going to try and use a slide. I apologize, guys, they're a little bit out of order, but so 1.1 billion people without a legal identity, like I said. And I attribute that largely to this. This is a problem in our minds of market failure. While technology enables us to provide someone a digital identity, the sort of current ways that we think about funding identity are a complete mess. The thing that we found in looking at this, and identity is a relatively new term in the development community, but we've long played roles in providing various pieces of this, whether that's birth registration, voter registration, registration of a refugee, et cetera. And the flow of funds that we've created to fund all those different projects looks, you have the US government funding, 4 different international organizations, all of whom then direct money to different institutions in country who then all fund different programs. And this is replicated across every single country, with the result being that these funding streams actually incentivize the creation of siloed, non-interoperable systems. That's where we need to focus if we're going to have impact. And I actually think it ties back to what we heard earlier, that you have to act your way into a new way of thinking. We can't continue to fund things this way and expect that we create a solution that is more useful for individuals.
So I look at a picture like that, and first, unfortunately, it looks really familiar. And I sort of imagine 3 or 4, or if not dozens of the areas we work in, we could draw something like this where unintentional consequences of how things are funded result into fragmentation that everyone regrets and tries to undo by creating yet more initiatives that tie the other ones together. But this, at the same time, also makes clear that while the technology may help, this may not be fundamentally a technology problem. And while we were talking earlier, you used a phrase that really resonated strongly with me about a big part of the task that you've undertaken is creating, as you said, ecosystems of supporting organizations. So say a little bit about that. This is a very big lift. What are the ecosystems of players and capabilities that you're trying to bring together?
Sure. So for digital identity to be useful, and I keep returning to this, it's really important that it's something that's persistent and portable, right? You imagine a refugee fleeing from Syria, they cross a border, perhaps they didn't have time to find their identity documents, perhaps that was a risk factor as they fled and they chose intentionally not to keep those documents on them. But then imagine them arriving in a host country or refugee camp with nothing to prove who they are. And sort of the current experience of a refugee in that situation is that they're interviewed ceaselessly by all the various institutions with which they then interact, whether that's the UN systems, the NGOs, the host government, et cetera. It's as you'd imagine, a really traumatizing experience. And I think it highlights sort of the complexity of what we're trying to solve, right? We need a solution that somebody can use verifiably, that maintains their privacy so that as they flee, if they didn't want to be exposed, they had the potential to do that. And when they arrive, that people will trust. And to do that requires, like you said, a really expansive ecosystem. There are the tech companies that bring sort of relevant technical pieces to the puzzle. But we also need governments involved. We need non-tech companies who are perhaps the future employers, who if somebody's in your supply chain, this can be a benefit to you, and that then you can have that true visibility into who lives at the sort of furthest reaches of your supply chain. We need the organizations, the Gavis, the UNHCRs, others who have breadth and reach and trust with these populations. And I think what's interesting is that because, and I can go into some of the technical details, but because we can create a technical system now that doesn't really care how you enter the system, somebody could initiate a digital identity through interactions with their employer or through their government or through a trusted NGO or a faith-based organization in their community. It's somewhat agnostic. They could even do it themselves. And that's a really powerful thing in saying, people suddenly then have far more control over their identities and they can trust the system that much more.
So are we talking blockchain technology or what? Say a little bit more about that.
So blockchain is one very small piece of the puzzle. And we're actually very careful to say that we're technology agnostic. We believe decentralization is really important. There are sort of privacy and security risks posed if you were to have a centralized system in place. If somebody were to tell me that there was an entirely new and different technology that was not blockchain that could fill sort of the user requirements we're setting, that would be great and perfectly acceptable. But certainly the momentum right now is that blockchain can provide that trust and sort of that indexing across lots of different organizations. While perhaps, and there's, again, huge amounts of evolution in this space, but that biometrics can be a useful way of uniquely sort of tying the physical human to the digital identity.
I can imagine circumstances and places where I might be less excited about my identity being permanently known and verified by a system that was generated, maybe powered by American technology, and I'm fleeing various countries in the Middle East. Say a little bit about the unintended consequences, how you have to engage privacy communities and others on these issues. Where does that stand?
Right. I mean, the potential privacy risks if digital identity is done thoughtlessly are enormous. And I think there's actually something that we're watching very closely sort of in the space right now, where the sense is that digital identity is coming. It's not sort of a if, it's a when. And that conversation can either be led from a human rights perspective, or it can be led from a, how do we enable, sort of the greatest profits or the greatest control. And so that's, I think that's really where, in our work with some of the UN agencies, et cetera, where they're coming from, saying how do we ensure that we get out ahead of some of these new technical trends and ensure that it's done well.
Okay, so I have one more broad theme of questioning, and I want you to be thinking of any questions you may have, and when I open it up, we'll make sure there are mics. So I want to sort of turn it out and begin to address the audience, at least indirectly, and talk a little bit. Have you tell us a little bit about who some of your critical partners to date have been, like who's already in, and knowing what you do about our audience, what are the sorts of capabilities and resources and whatnot you're hoping to find in this kind of an audience?
Sure. So we're structured as a public-private partnership, and I actually maybe will rewind for a second to the sort of story of Gavi's founding, because I think that that's something really instructive in how we think about solving this market failure, and how we've structured the organization. And essentially, the logic at the time was that there was lots of funding currently going into, this is relating to Gavi, lots of funding going into the global health landscape, but the funding was following really sort of circuitous streams of funds, and as a result, the ministries of health and whatnot in these developing countries were unable to scale up immunization and other programs that were seen to be cost effective. And the logic of sort of Bill Gates and others in founding Gavi was saying if we can correct that flow of funds, we can suddenly then change the incentives, and we can do so in a way that makes it possible for these governments to scale up the programs. Like I said, Gavi funds the 73 poorest countries in the world, which collectively have 60% of the world's kids. And if you imagine as a pharma manufacturer in that sort of previous world, that was 60% of the world's population that you'd been unable to sell into. And so the pharma companies for the vaccine market essentially have only been focusing on 40% of the world's population. And what this group hypothesized was, we can essentially make the market economics work so that we can fund vaccination for the entire world's population, and it creates a functional business for pharma. We think there's something very similar here, right? When we've got a flow of funds that looks like this, there's no market that makes sense, and it's really difficult for companies and organizations to get involved. And so what we've done is say, in part, we need to create an alliance that's an open, very clear governance structure, right? So there's transparency in thinking through a lot of these questions, so that the relevant stakeholders, whether that's the UN agencies, national governments, companies, et cetera, have a venue to discuss some of these really genuinely thorny conversations, but also that we can then create a pool of funding that allows for investment in systems that are far better both for the end users and for the purposes of sort of ensuring access to services. And what that does is then that creates a functional market on top of it. And so we're actually genuinely really excited that this is something that can be a business opportunity for the many different partners that we bring to the fold. I think that almost the short-term rationale for many of the companies that we've been partnering with, and Microsoft and Accenture have both been sort of early founding partners, has largely been around supply chain. And I think particularly for Microsoft and others, they sort of say, to look out at the furthest reaches of our supply chain is genuinely really difficult right now. You can sort of disaggregate down to a certain point, but it's often very difficult to get down to the actual individual. And so if you can create a system that provides access to those individuals and empowers them, that is really compelling. I think the other piece is that the organizations that we're working with see how digital identity is relevant both for these very vulnerable populations and for you or I. This is one interesting example, but Accenture looked at the model of what we were trying to create and said, we currently finance, when any one of our consultants is sent to a new financial sector institution, we pay for yet another background check. It's just a required sort of pro forma thing that they do every time a consultant is sent to a new site. If there's a verifiable way to ensure that these people are who they say they are and they bring the credentials that they might, that can solve an enormous business problem for us. And so Accenture is actually talking about how they can take exactly the same relevant technology and turn around and use that for something inside their own business.
In terms of the capabilities that the Alliance most needs now, so funding I'll take for granted,
Yep.
would always be nice. What are some of the capabilities you'd like to see added to the network? I think you mentioned security and some other things.
Yeah, so I think security is certainly one of them. I think we have sort of some strong technical voices, would always take more. But I think that the place that I'm most enthusiastic are about some of the organizations with these really massive supply chains who can provide almost an alternate lens and a different way to reach people where they are. And so if you have a really big supply chain, I want to talk. But I think that the perspective of sort of how do we engage with these communities that we oftentimes we only know of through sort of a government lens is a really important and sort of needed piece of the conversation.
Massive supply chain. So the wisdom of the conference agenda organizers following the HER project here. I see Aditi nodding over here. I think I know what one of the afternoon conversations will be, which is terrific. So we've got some minutes to bring this conversation out to you. I've got at least one mic here. Put your hand up if you've got a question or a comment.
I guess maybe while people are coming up with questions, just one thing I'll add. So we are, I realize I didn't get a chance to say this yet, we're working with UNHCR and Gavi to do 2 pilots in 2018. So these will be pilots demonstrating sort of the potential value for refugees, sort of speaking to the use case that I described earlier, and then a pilot with Gavi around immunizing children and essentially digitizing that child health card. So the sort of story I told about how I originally got into this, I don't know how to go back on the clicker, but there are countries that are immunizing vastly more children than we register, and that's, to me, a tremendous opportunity. And so if we can figure out how sort of early in life, when that child is in the hands of a trusted caretaker, we can provide them with sort of the early starting points for digital identity, that is something that...
So just link it to the immunization.
Yeah, something we're really excited about.
All right, do we have any? We have one? Oh, yeah. And please tell us who you are and where you're from.
Hi, I'm Martha Rabor from the UN Foundation. First of all, thank you so much for your insight and talk about Gavi. I had up a campaign, Shot at Life, where we work very closely with Gavi. And you answer my question a little bit, but I know there's a lot of challenges around refugee populations or just, large movement trying to figure out if children have been immunized or not. And I'm thinking that what you're working on could be a solution. I know a lot of times they're just immunize again. There's some immunizations that aren't harmful, and then at least you have populations covered because of the refugee settings and the close proximity. A disease like measles could be catastrophic. So I just love to hear a little bit more the work that you're doing with Gavi and using digital immunization records.
Sure, that's a perfect example. And I think really does illustrate why we need to think of digital identity not just for refugee populations once they've maybe arrived in the point of, in the host country, but how we reach people really early in life. Because the truth is that we don't know when any of us could be displaced. And so, figuring out how we reach broad swaths of the population early in life ensures that they get the protective benefits of this, sort of no matter what might happen. In terms of the work specifically with Gavi, it really does center on this notion that we are immunizing children who we don't know about in any other formal way. We estimate that 98% of children receive one dose of something. So, while only 86% of children are receiving the third dose of the DTP3 vaccine, most children on the planet are receiving one dose of something, and that's just a tremendous opportunity. Is that good to cover it? Cool.
Great. Well, I think that may be it. I'm just going to end with a plug. You're doing a deeper dive breakout session with us tomorrow,
Yep.
which has got one of the better names, New Kids on the Blockchain. Okay.
That's correct.
Yeah. So please, if you are interested in this topic, I think it's a fantastic, another one of these examples of something that you might not think about when you first look at what makes things work, what do we have to get right, and also a great example of something enabled by technology, but in order to make it work, there's some good old-fashioned coalition building and lots of other things that need to come together. So you'll get a chance to hear more about it. I thank you so much for joining us and look forward to more. Thank you.